Hello, I'm Dr. Keith Evans with Atlanta Human Performance Center, Physical Therapy and Fitness. I'm here today to talk to you about diabetes and some quick facts. The big picture about diabetes. 34 million people in the United States have diabetes. 1 in 5 don't know that they have it. Diabetes is the 7th leading cause of death in adults in the United States. In the last 20 years, the number of adults diagnosed with diabetes has more than doubled because the population has aged more and become more obese and overweight. Type 2 diabetes, which used to be referred to as adult onset diabetes, is responsible for 90 to 95% of the cases diagnosed in the United States. Type 1 diabetes is responsible for 5 to 10% of the cases diagnosed in the United States. You are at risk for developing prediabetes or type 2 diabetes if you're greater than 45 years of age, if you're overweight, if your parent or brother or sister has diabetes, or if you're not physically active greater than 3 times a week. African Americans or Hispanic Americans or American Indians are more predisposed to developing type 2 diabetes. During their lifetime, Hispanic men and African American women are twice as likely to develop type 2 diabetes. The main contributors to type 2 diabetes is obesity and inactivity, as well as some familial predisposition. If you are overweight and you do not exercise, you are at a higher susceptibility to develop diabetes. In its simplest form of diabetes type 2, the body is unable to extract the sugar from your bloodstream and therefore destroys small blood vessels in your eyes, toes, and fingertips. Exercise and diet are 2 of the ways to combat or lower your blood sugar. If you exercise 30 minutes a day for 5 days a week, or 75 minutes 3 times a week at a higher intensity, your body is able to take the sugar out of your bloodstream and use it in the muscle. High blood sugar is very destructive to the very small blood vessels which are occupied in your eyes, your fingertips, your tongue, and your toes. Non-diabetics have a hemoglobin A1C at about 5.7. Our goal is to get your A1C lower than 6. Higher A1Cs are destructive to your eyes, fingertips, and toes of the small blood vessels. This can cause blindness, loss of sensation, amputation, and debility. Uncontrolled diabetes can lead to heart disease and kidney disease. Poor blood flow in the legs and feet, which can cause infections, ulcers, and possible amputations, as well as it can cause retinopathy, a disease of the eye that can cause blindness. Peripheral neuropathy, which can cause pain, numbness, poor circulation, and lack of knowing where your feet are in space. Well-controlled diabetes elicits a hemoglobin A1C of about less than 6. Individuals without diabetes have a hemoglobin A1C of about 5.7. Medication, if needed, exercise, and maintaining a low body fat or a good body weight all contribute to having a good level hemoglobin A1C. If those ranges are attained, you won't have the adverse effect of blindness, heart and kidney disease, and peripheral neuropathy, which is numbness and tingling and pain in your feet, and poor circulation, which leads to ulcers, which leads to possible amputations. It's very important to exercise 5 times a week for 30 minutes at a moderate activity level, or 3 times a week at about 75 minutes at a more intense level. 150 minutes per week of exercise is your goal. If you do that, you will be able to keep your vision, prohibit yourself from having peripheral neuropathy, amputations, and blindness. Just for the health of it, Let's do those things and help eradicate diabetes. I'm Dr. Keith E. Evans with Atlanta Human Performance Center, Physical Therapy and Fitness. Come visit us at the facility at 3250 Hogan Road, Atlanta, Georgia, or visit us on the web at www.ahpcpt.com. I look forward to bringing you more informational videos and seeing you here at the center. Have a wonderful day.
The information contained in this audio recording from Atlanta Human Performance Center is not meant to replace any information from your primary healthcare physician. Please consult your primary healthcare physician prior to starting any exercise program.